My name is Tamara, and I'm a public health educator. So what I do in my normal day is I'm a teacher. I'm a professor and a public health educator at the New School, which is a private not-for-profit university. The other piece of being a public health educator is that I am a harm reductionist, and I am part of a group here in the Bronx, here in New York City, that works street-based harm reduction. So we work with folks who are housing insecure or who are experiencing homelessness, who are also active drug users. And we hit the streets and we go out to where they live, literally different neighborhoods of the Bronx. How do you do harm reduction that is ambulatory, that is on the streets, that is bilingual, culturally appropriate, can be really, really challenging in these times when we're told you need to be 6 feet away. You can't touch, can't hug. So that doesn't mean that we haven't been doing the work. In fact, we've done outreach on several occasions since the pandemic hit New York City. But that has meant the addition of occupational safety tools, from wearing gloves to wearing a face mask to no hugging. You know, how do you tell somebody who's living on the streets to go physically distance themselves, right? What does that mean? What is available to them? That's been really challenging.
Specifically in the work that you do, what do you think the long-term effects of this period are going to be?
The long-term effects, I think, are that there will be a palpable shift in how we interact. New York is where I live, but my home is Puerto Rico. So I go to Puerto Rico every summer and every Christmas, right? Every winter. My mom and I were on the phone the other day, and she said, I don't think I'm going to see you for another year. And for me, it was the first time that somebody had voiced it. It hadn't even crossed my mind that that could be a possibility. So for me, in terms of the familial dynamics of sustainability of life in New York City, it may palpably shift. How often I am able to travel to the island, to my patria, to my homeland, is going to be markedly different from what I have been able to do in the past. So how I relate to my loved ones that are part of the Puerto Rican diaspora, where we are everywhere, but very well connected and with constant traveling because we have the privilege of U.S. citizenship and so can travel very easily.
Right.
That's going to be a major shift. And so I haven't exactly come to terms or explored that one deeply because it hurts. The fact that I will not be able to see my family in a little bit. And part of that as well is that my parents fall into that category of risk, right, of being over 60 years old. So that's like, how do you care when you're not physically there? In terms of the university platform, I think part of the shift will be the need to embrace online learning and teaching. The implications of that is, what does digital equity look like in our community? So if I'm working with folks and we're really, as a teacher, I really need to think about who has a computer, what kind of computer, who has a smartphone, who has a flip phone, what does home life look like? Is there the privacy in order to be able to engage in the digital platform? And those are all kind of considerations that I think the higher education, the K through 12, all people involved in education really need to come to terms with. That if we do need to move to a digital online learning environment, what does that mean for working class and low income communities? And then what are the macro structural issues, policies, procedures that need to really step up? Because we've been talking about digital equity, poverty, economic inequality for a really, really long time, but it's been a Band-Aid approach. But I think with the pandemic, if we really want to create effective, sustainable education systems for all of our community members, we really need to grapple with what does it look like for different people across different socioeconomic classes and communities. The third one that I would say is around Bronx Mobile, which is the community-based group that we do harm reduction here in the Bronx. In some ways, that's the one I'm most worried about, because I think that people who are housing insecure, homeless, poor, living on the streets, in some ways, it's not just that they're the very vulnerable. I think they're also seen as disposable in our society.
Yeah.
And so I I worry about what that community of folks who I consider my community will look like 6 months from now.
Yeah.
I do worry about them. Will they be able to access the medical services necessary if they do get sick? I just don't think that they will have equal access the same way that other folks from the community that have stable health insurance, that have a home, that have a system of support will be able to access in the same way. And I know of a lot of community-based agencies, whether they're fixed or in service providers or shelters for people who are living on the streets and housing insecure, HIV/AIDS organizations. They're all kind of grappling with how do we provide care,
Right.
ongoing care to our folks during the pandemic. And the question is a challenging one because of occupational health hazards for their employees and their staff, even for other participants that come into the agency or clinic, as well as how do we continue to provide services to our participants. And I think that's ongoing. Again, I don't think
Yeah.
we have an answer yet. And I think it's going to continue to shift as we live through this process and this experience of COVID-19.